Hi, this is Dr. Prashanti. I'm an ENT surgeon from Alekia ENT Care. I'm just going to talk with you an important condition that's called vertigo or dizziness. Yes, there are various terms available. Some people say that complain they have vertigo, and some say they have dizziness, and some say they have spinning, they have a spinning feeling. Okay, so whatever it is, so in generally a technical term or a medical term for this is vertigo. There are various levels from which the vertigo can arise. A simple high blood pressure or a low blood pressure can also lead to vertigo or dizziness. But usually the commonest causes for vertigo are either in the brain or in the ear or in the spine. So the first condition is the brain. Anything like hypertension or any tumors in the brain or abnormal blood flow in the brain can cause vertigo. The second cause is the labyrinthine cause. Labyrinth is nothing but the other name for the ear. Any problem inside the ear, either a middle ear infection or an inner ear infection, can cause vertigo. So there is one important thing to be discussed here. Ear has two functions. One is an auditory function, the second one is a labyrinthine function. Auditory function is the function with which we hear, okay, whereas the labyrinth is maintaining of your position. The balance and the position of the body is maintained by the labyrinth of the ear. Any abnormality in this labyrinth, either on the right side or on the left side, can lead to vertigo, and labyrinthine vertigo is the most common condition. The third one is a cervical spine condition, something like a spondylitis or any abnormality in the cervical spine can cause this vertigo or dizziness. Now coming to the treatment part. So how do you treat this vertigo? The first is identification of the site, from where the vertigo is arising from. Is it from the brain, from the ear, and from the spine? The second rule here is what is the frequency of the vertigo and what are the associated symptoms with, like nausea, vomitings, or you have sometimes the patient even may go into a fit, and sometimes patient always commonly complains of headache. So there are various associated factors which have to be taken in consideration. Okay, so based upon the symptoms and the history given by the patient, we usually come to the conclusion. But yes, we have an advanced technology available for vertigo evaluation now at our clinic. And this is called, this is a complete, we are tied up with a neuroequilibrium branch, so which is basically based at Jaipur. We have various methods by which the vertigo can be evaluated and treated. The main way by which we can, we can go ahead once the patient comes with a vertigo is with some body movements and some positions, and the way your brain works, and everything will be taken into consideration. And we usually try to come to a conclusion whether the vertigo is originating from the brain, from the neck, or from the ear. Once we find out, so we have a detailed investigation done. So once we have a clear idea from where it is originating, based upon the underlying cause, we try to treat it. For example, as an ENT doctor, I am interested more in a ENT case, right? Something like a labyrinthine vertigo. So what do we do? So for example, you have a vertigo that arises from headache and stress and strain. That is called as a vestibular migraine. So in those conditions, we just put them on medication. Apart from that, we also put them on music therapy, and we ask them to go for yoga, meditation, so that the stress levels come down. The second condition is called as a BPPV. Okay, it's a positional vertigo. Patient complains of vertigo only when they are in one particular position. So in those cases, we usually go for some maneuvers. We have various maneuvers. Maneuvers is nothing but the positions, the various positions by which we can, so by tilting the head or by various positions, we can solve this problem. Yes, there are some conditions like, similarly as the age advances, you have a hearing loss, right? So similarly is a condition where with the age, some amount of dizziness or vertigo can be found out. In those cases, we just put them on exercises. These exercises are called as a vestibular rehabilitation exercises. Okay, so these exercises, when done 5 minutes in the morning and 5 minutes in the night, so in the evening or in the night, whatever it is, so usually they bring your body position under control. Thank you.